Everyone, welcome. Welcome to everyone joining. We are so delighted that you're here today. My name is Cecilia Sorensen, and I'm the director of the Global Consortium on Climate and Health Education based at Columbia University. And today is the launch of the Caribbean Climate and Health Responder course, our second edition, which is focused on education for action. This course is brought to you by an incredible number of partners from around the Caribbean and around the world, including EarthMedic, EarthNurse, the Pan American Health Organization, University of the West Indies, the Caribbean Institute for Meteorology and Hydrology, and the Global Consortium on Climate and Health Education. So again, thank you so much for being here. Just to give you a notification, we do have interpretation available for this course in English and in Spanish. To switch which language you hear through your computer, you just go to the globe at the bottom of your screen, click the globe, and select the language which you prefer, and that's the language which you will hear on your computer. So with that, we'd like to start by getting to know everyone here in the audience today. And so we have a Slido prepared, and Haley, why don't I turn it over to you to share your screen? Thanks everyone for letting us know where you're coming from in the chat. So if you go to slido.com and type in this number here, 2550205, or scan the QR code, tell us what country you're coming from, and we'll make a big Jamboard seeing where everyone's coming from. We'll give that a couple seconds here for everyone to go to slido.com and let us know where you're coming from. Colombia, Suriname, USA, Trinidad and Tobago. We got a bunch from TNT, Nicaragua, Bahamas, Puerto Rico, Costa Rica, Jamaica. Wonderful. From Barbados, from Spain. Oh, wow, now it's getting too fast. Guyana. All right, and the bigger the name of the country is, the more people there are coming from that country. So you've got to let us know where you're coming from, and let's see which country has the most health professionals joining today. Lots from TNT, Jamaica, Puerto Rico, wonderful, USA, and from all over the place. So wonderful. All right, let's go to the next question. So the next question is, and you still go to slido.com, is what is your profession? Are you a medic? Are you a nurse? Are you an environmental health professional? What is your profession? Are you a student? You see, we've got a lot of physicians, we've got anesthesiologists, health consultants, MPH students, environmental sustainability professionals. Amazing. Psychologists, dietitians, scientists, biologists, lecturers, first responders. Incredible. People doing monitoring and regulation, humanitarian work, and so on. Ophthalmologists. Incredible. All right, 20 more seconds here. Slido.com and put in what your profession is. All right. Okay, and the next question. This question is, what climate change and health topic are you most interested in? What is it that brought you here today? What is it about climate and health that you are most interested in or want to know more about? So you can let us know at slido.com by typing in this number at the bottom here. Disaster management, mental health, air pollution, adaptation, monitoring and evaluation, asthma and allergy, smart health facilities, waste management, equity. Amazing. Wow, so many different important and interesting areas related to climate change and health. many, if not all of which we are going to talk about in this course, which is incredible. Thank you everyone for letting us know. Heat mapping, surveillance, mitigating risk, health access, vector-borne diseases, public policy, all such important topics that we will be focusing on in this course. We'll just give it 5 more seconds. And this is really wonderful just to hear all these areas of importance to you, because we want to make sure that this course is going to really answer your questions that you have. Okay. Fantastic. All right. Well, I think we can wrap that up. And again, welcome everybody to this course, the second edition of the Climate and Health Responder course for the Caribbean. So let's get started here today. I want to tell you a little bit about how this course is going to run over the next month, and then we're going to jump into our first lecture and hear from our first speakers today. So as you know, this is a 10-session course, which is going to be meeting Tuesdays and Thursdays from now until May. Same time, same link, and we will see you here. These are our objectives for the course. So we are aiming to increase health professionals' knowledge, self-efficacy, and communication skills related to the climate crisis, so they can both improve patient and public health practice, as well as serve as their health community's trusted messengers within their institutions, communities, and fields of practice. We are aiming to equip interested health professionals with the knowledge and skills needed to educate their institution's own learners. And we are aiming to build and strengthen an agile and informed community around climate and health education, advocacy, and policy for health professionals with strong mentorship and expert support. So these are going to be 90-minute sessions, and every session will be structured similarly. There will be an expert lecture followed by a case presentation, which is all going to come from speakers and from experts in the Caribbean region. Each session is going to culminate with a question and answer session. And so what we ask is that if you have questions for our speakers, that you use the Q&A function located at the bottom of your screen. You can ask questions at any time. And after our speakers are done, we will then moderate the Q&A and try to get to as many questions as possible. Every session will be recorded and it will be posted on the website within 24 hours. We're going to put the link to the website in the chat right now. Recommend that you bookmark it so you can always go back and find these lectures if you need it. On that website, you will also find reference materials and the slide decks that our speakers are going to be using to give their expert lectures. We're offering a certificate of participation for this course on behalf of Columbia University and EarthMedic, EarthNurse, and the University of the West Indies. You will be eligible for our certificate if you attend more than 70% of the live Zoom sessions and pass a final exam at the end of the course with more than 70%. Just to note that in order for your attendance to be recorded for Zoom, you do need to join using your unique link. So don't share links, just share the registration site with your friends, and always join using your unique Zoom link so we can be sure to record your participation. The next thing to tell you about is that we are also offering CME credits for this. They will be available to anyone who is working within the CARICOM community region. The CME is being given by the Caribbean College of Family Physicians. And what you will find is at the end of each session, there will be a link in the chat. We'll also announce it where you'll go and fill out your form to claim your CME credits. So as we get started for today, I want to send a huge thanks to our incredible course planning committee from EarthMedic, EarthNurse, from the Global Consortium on Climate and Health Education, and from the University of the West Indies and PAHO. This would not have been possible without this tremendous collaboration. So thank you all so much for your hard work to make this course possible. So today we're going to jump into our first lecture and our first case study, which is going to be an overview of climate change for the health professional. Now, for each of our sessions, we have learning objectives. I won't read them through all here, but you can find them on the website. We are going to try to answer all these questions today and enable you to be able to understand these learning objectives and apply them to practice. And to do that, we have two incredible presenters. two experts from the field. Our first speaker is going to be Dr. James Hospedales. Dr. Hospedales is the founder and managing director of EarthMedic, EarthNurse, which was founded with a vision to mobilize health professionals to urgently address the climate and health crisis. Prior to this role, he was the inaugural executive director of the Caribbean Public Health Agency, where he led the agency to become a recognized player on the global health field, weathering several public health emergencies and developing the innovative tourism and health partnership while raising the alarm on the climate and health crisis. He is a graduate of UWI and the London School of Hygiene and Tropical Medicine, and he is also a fellow of the UK Faculty of Public Health and an accredited partnership broker with the Partnering Institute of the UK. After we hear from Dr. Hospedales, we will then turn over and hear from Dr. Edward Maibach, who is the director and founder of the Center for Climate Change Communication at George Mason University, where his research works to illuminate public understanding of climate change and strategies for enhancing it. And so with that, it's my pleasure to turn it over to Dr. James Hospedales. Thank you all so much for being here.
Well, good evening, everybody. Bonsoir, buenas tardes to all the colleagues from America Latina and everyone from across the Caribbean. I am excited to be the first batsman. If you talk about cricket, we speak of being the first batsman in this match for our second edition of the Climate and Health Responders course for the Caribbean. So let me bring up the slides. Oh, I gotta share screen, right? See, I'm so excited. I'm forgetting what I'm supposed to do. ¿Dónde está? Aquí. Muy bien. Good. Are we seeing this? Is that coming through okay, Haley?
Yes, looks great.
Okay. So thanks again, everyone. This is the inaugural lecture to the start of this course, looking at climate and health, climate change for the health professional. So this is a sort of a grounding for the rest of the course. And everything I'll touch on will be further expanded in the lectures and practical sessions to follow. Thanks to Cecilia, colleagues in PAHO and CIMH for being great partners in putting on this course. And UWI, St. Augustine, Chris Aura is also one of the partners in this. So why do I do what I do? Well, these are my three grands, mis nietos, Emilio, Kai, and Luca. And when I look at them and I think of the world that they inherited, I think I got to do something to try and bend the curve on climate change. And I think health professionals have a really important role in this global struggle to contain temperatures, which we'll talk about as this progresses. The objectives, Cecilia just went through. In addition, I'll briefly explain what is the Paris Agreement and its key aspects, since if you're in climate change, you're going to hear a lot about Paris Agreement. And I believe from the registration data, more than half the folks who registered had not attended any climate and health training before. So this is going to give you some of the basics, some nails to hang things on, some hooks to hang things on, and you can pick up the rest of it in the course. That's a few basic definitions about what is the difference between climate change and weather. I used to be puzzled about this, but climate change and weather are different. Climate change is long-term manifestation of the weather. So if your mother says, take your umbrella, it looks like it's going to rain, she's really talking about short-term changes in minutes and hours and days and weeks. In Trinidad and Tobago, we have a saying, if the rain and the sun are going at the same time, then the devil and his wife are fighting. El diablo y su esposa están peleando. If an old-timer says, it never used to be this hot when I was a boy, Well, that's a long-term thing. He's talking about when he was a boy more than 30 years ago. And the last concept here is the concept of a climate time scale, which is agreed to be about 30 years. So I've been around for more than 2 climate time scales. What's causing climate change? Well, natural cycles have altered Earth climate previously, but the current global warming is mainly attributable to human activity. And the heat we experienced last year, the unprecedented heat, is a manifestation. And specifically, what's causing climate change is the burning of fossil fuels such as coal, oil, gasoline, and natural gas. And we don't seem to be slowing down enough on this to stop the problem. Burning from fossil fuel leads to what is called global warming or global heating, which many people think is the main manifestation of climate change. Climate change is actually more than just global heating, but that's the main manifestation, causing a stronger greenhouse effect, and atmospheric carbon dioxide levels are now at 421 parts per million. When I was born in the 50s, it was 313 parts per million. So you can see how much it has increased in that time. The main greenhouse gases we're concerned about are carbon dioxide, methane, nitrous oxide. Now, carbon dioxide is responsible for the majority of the global warming, but methane, which is a very potent greenhouse gas, there's a lot of worry about this because it is also coming out of natural sources as the planet warms up. And the implications of all of this are profound for all of us, for all life on this planet and the economies of the planet. When you look at countries, there are publications you can see on the per capita footprint of carbon dioxide and the per capita wealth of the country. So if you look at the bottom of this chart here, you see a lot of the lower income countries, many are in Africa, and they also have a low level of carbon dioxide output. Not all, but many do. In the middle, you see a lot of the Caribbean countries, you see a lot of Latin American countries and middle income countries. And up on this end, you see a lot of the rich countries, the high income countries of the world that produce a high per capita carbon footprint. So the United States is up here at about 12 tons per capita. But where is Trinidad and Tobago, my country? Well, Trinidad and Tobago, I'm sad to say, is off this chart because our footprint is 25 tons per person per year of carbon dioxide because we produce oil and gas. And if this chart were extended, you would see we are in the league with the oil-producing countries, for example, of the Middle East. The words that I just used, let's break this down into pictures. Fossil fuel use leading to climate change, causing impacts. So this is a picture of an industrialized setting with a lot of fuel being burnt. And this is so for electricity generation in most places. It is so for cars that we all drive around, or most people drive, for agriculture, for industry. This is what's happening. We're producing carbon dioxide, which goes into the atmosphere. And that carbon dioxide has been accumulating in the atmosphere. So from around the time I was born, 60 odd years ago, it's been a steady increase year on year on year. There's no sign at the moment that this is declining. For COVID, we had a slight dip in it, but this graph continues to increase the annual concentration of carbon dioxide. And what does that mean? Well, the Earth is surrounded by an atmosphere which has a certain amount of carbon dioxide in it. And let me be clear, carbon dioxide, a certain amount, is important for life on Earth. If there was no carbon dioxide, the planet would be cold and lifeless. So carbon dioxide wraps us in a sort of a blanket and keeps a good balance. And we've been in balance for thousands of years. But humans, by burning fossil fuels and releasing carbon dioxide and methane, have changed that balance. So the incoming solar radiation is being absorbed in greater and greater amounts and not radiated back out into space, is being trapped. and that is increasing the temperature. So if you look at mean annual temperatures over a 200-year time span, you see that in the last 100 years or so, it's been pretty steady until the last 20, 30 years when it's beginning to go up. And the projections are that it will continue to rise if we don't bend the curve on this problem. And the impact of this, we have been feeling on the planet. Heat waves, drought, incredible fires, more intense hurricanes, extreme rain, floods, landslides, sea level rise. Those of us who live in the Caribbean, we certainly know about this. But if you're in Africa, you know about it. If you're in Latin America, you know about it. Even in the United States, they are facing drought and fires. In Europe, incredible drought and forest fires, so that nowhere is climate comfortable anymore. Many health problems arise from this: epidemics, non-communicable disease, enfermedades crónicas no transmisibles, mental health problems, conflict and migration. These are the common manifestations. I give a shout out to my colleagues in the Bahamas, since this slide was developed during a training course there, and I thought it was a good way of showing this connection. Now, if you want a longer time scale, let's go back 20,000 years and put heat in a historical perspective. And you see that human civilization got underway as we know it, with cities and agriculture, maybe 10,000 years ago. And we've been living in a sort of a comfort zone until about 150 years ago, 5 generations ago, 6 generations ago. And now we're at 1.1 degrees above the baseline, and we already see the problems associated with this, the catastrophe, the disasters. And this is what's projected, my friends. 2 degrees by 2050 if we stick to current policies, and 4 degrees on the current policies by 2100. This really scares me and alarms me, and it ought to alarm everybody who is listening and looking at this, and we should all galvanize ourselves to change this. That extra heat is actually mostly in the oceans. About 90% of all the extra heat I've just talked about is stored in the oceans. And there's been one calculation that the amount of extra heat is the equivalent of 5 Hiroshima atomic bombs per second, every second, for the last 25 years. That's how much pressure we're putting on the planet. And these ocean heat waves kill a lot of fish and marine mammals. And if you're in the Caribbean, they bleach the coral reefs, and that has a lot of implications for our health and food security. So you could say patient Earth is sick. And here's a young child demonstrating with an interesting sign: allow me to have a future. This is a message to the older generations, the adults, the governments that have a possibility to change this. Climate change is not the only problem we're dealing with. There are some related problems, such as pollution, which I call the evil twin of climate change. And the second evil twin is biodiversity loss, particularly from the destruction of nature and forests and wetlands. And here you see a picture of the Amazon rainforest burnt. And these poor fellas, this family, they're traumatized. Where are they going to get food to eat in this environment? So climate change is the thing we're focused on in this course, and there are a number of other related problems that patient Earth is suffering from. If you're a physician, you're accustomed to the idea of multifactorial etiology. And so we have pollution, we have air pollution, we have loss of biodiversity, changes in land use, changes in freshwater use, polluting the phosphorus and nitrogen runoff from our farms is helping to drive the sargassum blooms that we see. We have ocean acidification, making it harder for corals and shellfish. About the only thing on this chart that's in a good place is stratospheric ozone depletion, because we figured out what was causing it and we did something about it. So this is the concept of planetary health, and climate change, which is related in one way or another to all of these, is the one we're focused on in this course. But there are other boundaries that we're pushing up against. Now, who cares about all this? What does it matter? Well, a lot of the health organizations of the world care about this. The business sector cares about this, except maybe the fossil fuel industry and the governments that are backing that. In fact, the World Economic Forum puts climate inaction as the #1 risk to the world. And the major faiths of the world, the Abrahamic faiths, Christianity, Islam, Judaism, they all agree on this. Hinduism as well, and the indigenous religions never lost sight of the importance of the environment. What about governments? Well, governments have formed a legally binding international treaty on climate change, which we call the Paris Agreement. And if you get into this space of climate and health, you will hear about this, the Paris Agreement. It was adopted by 196 parties at the UN Climate Change Conference in 2015. That was the Conference of the Parties number 21. Now here I put in fine print to make it hard for you to see, and that's deliberate, that in this famous agreement, health is only mentioned once in the preamble. That's incredible, right? Other agreements that are relevant to this, like the Sendai Agreement on Disaster Risk Reduction and the Sustainable Development Goals, have health as integral to them. But the Paris Agreement has not got much consideration of health. This is changing. And last year at the Conference of the Parties, which I think Cecilia, who's jointly co-director of this course, attended, health became much more prominent. So we're kind of late to the dance. We're late to the dance, but we're really important as stakeholders. Now, the goal of the Paris Agreement is to hold the increase in global average temperatures to well below 2 degrees above pre-industrial levels, and preferably 1.5. And why 1.5? Well, the Caribbean countries fought for that with a slogan 1.5 to stay alive. And there's plenty of scientific evidence that above 1.5, things really get bad. And they're bad now, but we will experience extreme catastrophe above 1.5. And so all the effort is to try to keep it at 1.5. I'm not very sanguine seeing the way the world is going, unless the 30 or 40 million health professionals in the world can unite in an unprecedented way to say enough. I'll draw your attention to something called the NDC, the Nationally Determined Contribution. This is the key national instrument of the Paris Agreement to limit temperature rise. It has a 5-yearly cycle of updating, and it sets out priorities and commitments to mitigate and adapt. I'll say what those are in a moment, taking into account national circumstances. It's voluntary, but nearly all countries of the world, just about all, have submitted NDCs, which look at how you're going to reduce your national emissions, how you're going to build resilience, and what do you need. So it specifies targets, measures, policies, and financing needs. I recently was involved in a review of 16 countries from the Caribbean, the NDCs, and health is mentioned, but we lack specificity of target measures, policies, activities, budgets. So those of you who are from the Caribbean in the public health space, in fact, wherever you're from, find out about your NDC in your country and get health more inserted into it. To limit global warming to 1.5 degrees, scientists indicate that greenhouse gas emissions must peak by 2025 at the latest and decline by 2/5 by 2030. That's almost impossible, but not impossible if we really put emergency measures, the way you'd put emergency measures to a patient who is in serious way, and they're going to die unless you take major measures. I shared, I used some words there just now, just to define for anyone who's not familiar. Climate change adaptation is the process of adjusting to the effects of climate change. And those actions can be institutional, infrastructural, behavioral, or nature-based. Nature-based solutions are like planting trees on a vast scale. I was part of a G20 think tank last year and nature-based solutions can, if we fully implement them, will give us about 1/3 of what we need to control climate change. Climate change mitigation is the action to reduce the emissions of greenhouse gases or remove them from the atmosphere. And this is a controversial area because the scale and the cost of removing them is humongous. It's easier to reduce emissions, and that could include switching to sustainable energy sources such as solar or wind power, conserving energy, and increasing efficiency, from as simple as changing the setting on the air conditioning or turning off electricity lights that are not in use. And resilience, that concept is how well can we bounce back from climate hazards? The ability to recover from a hurricane, from a flood, how good are the disaster plans? How good are we with coping with droughts at the local level, regional and global? And each of these levels is important. If you live on a small island, you may be completely overwhelmed by a hurricane, and your resilience and your ability to bounce back is going to come from your neighbors. If you're in a state in the United States and you're hammered by a big storm, as happened in Florida with last year and the year before, then help comes from your neighboring states. I made this diagram because I think, yes, we talk about adaptation, we talk about mitigation, but folks, we have a lot of suffering ahead of us, more suffering as a result of climate change. So this chart shows that health is late to the dance, but we have also, we in the health sector, broadly speaking, have been begun to take this seriously. And in 2021, 200 medical journals got together with a single editorial: climate change is the biggest threat to public health. It's also a big opportunity if we act smart. And the small island states in the Caribbean and in the world, in the Pacific, are recognized to be extremely vulnerable by the United Nations, by the G20, among others. Climate change impacts are not evenly distributed. They are unfairly distributed, and they affect vulnerable groups: women and children, low-income groups, racially or ethnically marginalized groups, older adults, people with non-communicable diseases like diabetes, heart disease, or disabilities, and people living in certain areas. If you live close to the coast, if you live on a steep slope, many different areas. If you live in a low-lying area, as sea level rise advances, we have problems. This chart shows some of the social determinants of health and climate vulnerability. And one of the later lectures in this course by Carlos Ferron from Costa Rica is going to dive into this in much greater depth. So here you see the elements of vulnerability, such as how exposed you are by poverty and your occupation, if you're an outdoor worker, for example, how sensitive you are to the problem, and the adaptive capacity, if you have some income, your level of education. The climate, the middle column is the climate drivers, the exposure pathways, the health impacts, and the outcomes. And over here are examples. If you're in a poorer neighborhood, you're more likely to be exposed to some of these climate change threats and environmental threats. People with chronic medical conditions, I already mentioned, are more likely to have a serious health problem. And people with reduced access to care and preventive services are more likely to have a bad health outcome. In my country and in elsewhere, we're seeing that some of the flooding prevents people from getting to the health center or the hospital, and it prevents the staff from getting to work. So this climate change acts as a multiplier of threats that we already have, and it worsens conditions that we already face. So the doctors might be thinking, well, all that sounds very general. What does this mean for diseases and health problems? And I draw your attention to this chart from the CDC, which sets in the middle some of the problems we face with rising temperatures, more extreme weather, rising sea levels, and increasing carbon dioxide concentrations. And that then changes the weather, the air, changes vectors, changes the allergens in the air, changes water, food supply, environmental degradation, causes extreme heat. And then in the health sector, you see the heat-related illness and death and the cardiovascular failure. I had a brother-in-law who passed away recently, and I'm convinced his emphysema was made, he couldn't tolerate the heat that we were experiencing. Injuries and fatalities from extreme weather and mental health impacts. Come to our lecture on mental health in a few weeks' time, when we're going to be discussing the mental health impacts of the hurricane in Antigua and Barbuda. Asthma and cardiovascular disease from air pollution. I live in Trinidad, and every day I can, before I even go outside to see what the air is like, I can tell from my sinuses if we're having a bad Sahara dust day. And I'll say a bit more about that shortly. Vector ecology changes, increased risk of transmission of dengue and malaria, Lyme disease. We'll be addressing this in our lecture by Professor Christopher Aura later on in the course. Respiratory allergens and asthma, water quality impacts as you have more flooding, or the other way, you have drought and shortage of water, water and food supply impacts. And this one worries me a lot. What's going to happen to the food supply? If we think food prices are high now, they're going to get higher still. And the forced migration and civil conflict as a result of environmental degradation. So let's go into some of these a little bit more as I continue. Emergence of heat and humidity too severe for human tolerance is the subject of this article. And a few months ago, I experienced this. I spent 3 hours outside installing this gate. It was the house of my brother. It was 33 degrees Celsius and 85% humidity. And I thought I was going to die. So I went and I checked the temperatures. Why am I feeling this bad? Well, humidity, as I said, was 85%. And temperature was 33 degrees Celsius. And if you follow this chart on the heat index, you see that that was a heat index of 51 degrees Celsius. That's a dangerous temperature to be exposed to for a long time. And I had been outside, I wasn't so accustomed to it for 3 hours. And so it points to an important aspect of the problem with heat. Heat is higher, it's lasting longer, not just a day or two, but a week. And it's accompanied by higher humidity. And that is causing difficult hazardous conditions for outdoor workers, for security forces, etc. This is a picture of the drought in Jamaica in 2015. And the whole of the Northern Caribbean, including Haiti, El Salvador, Guatemala, experienced this problem of drought, which impacted on food and water security. This shows the worsening Sahara dust storms that we've been experiencing as climate change and drought advance in West Africa. More and more topsoil and sand is blowing over to the Caribbean. We've had this for centuries, but what climate change is doing is making it worse. And you can see here data from the Trinidad and Tobago Met Office. Over the last 40 years, there's been a steady upward increase in the number of annual dust days. 40 years ago, there were less than 50 days per year that were dust days. By 2021, there were 198 of those dust days. And when I talk to pharmacists, they say, oh, yeah, doc, we know when it's a bad dust day because we get more people requesting prescription medicines for asthma or for allergies. So this is another problem that we don't understand sufficiently about, and we need to do more research to have a basis for policy recommendations to the population. Of course, it's not only here in the Caribbean. This amazing, badly polluted air took place 9 months ago in New York in June of 2023, when asthma-associated emergency room visits almost doubled in New York State on the worst air quality day. Here you see someone taking a picture with the Empire State Building in the background, and this shows the map. You can't even see, but the worst polluted areas were the New Jersey, New York area. And there you see another apocalyptic type picture. So this is happening, imagine that, in New York, in the United States, as a result of Canadian wildfires. Another unimaginable, unprecedented thing is situations like this, where we had 3 Atlantic hurricanes, one after the other, at the same time. I used to be on the Caribbean Disaster Response Team, But this never happened. You'd have one hurricane and you'd have a chance to deal with that and recover to some extent. But here you don't have it's unrelenting. You don't have a chance to recover. And Jose, Irma, and Maria in 2017 were devastating hurricanes. Maria in particular caused a lot of damage to the island of Dominica, Puerto Rico, and many of the other countries around there. This shows 3 countries that were affected: the British Virgin Islands, St. Martin, and Puerto Rico. And the hurricanes don't care what language you speak if you live in Hurricane Alley. So the British Virgin Islands experienced a lot of damage. Importantly, this hospital stood up very well to the severe storm. And this is going to be the subject of another one of the talks later in this series on the PAHO Smart Hospital program. This is a good evidence-based, good practice-based evidence. St. Martin, severe damage. Puerto Rico. Now this chap here, maybe some people recognize him. He's a multimillionaire. This is Richard Branson, the owner of Virgin Atlantic. And he has a home and an island. He owns an island in the British Virgin Islands. Well, what is the difference between this man and this lady? He has wealth. He has means to recover. She's thinking, where do I start to rebuild my house? She may not have insurance. She wouldn't have the kind of cash reserves to deal with this problem. So here you see an example of the inequity, the unfairness in how climate change plays out. And if you have resources, you can maybe be more resilient. This picture on the left I took from an aircraft on October 20th, 2018, when we had unprecedented floods in Trinidad. This had never happened before, that the north and the south of the country was separated. And if you were on the north side and you were working, but you live on the south side and you were dependent on insulin if you're diabetic, you would have a hard time that unless you have friends or relatives in the north, you were going to be stranded for 24 hours or more. And here you see people, this is a common scene in the Caribbean, in Latin America, in many places now, with floods requiring people to leave their homes. After the flood comes the problems with water, because the flooding will typically affect the water supply system. So they have to shut off. Here you see on this headline, 200,000 customers in 2 communities without a water supply. So then they don't have potable water for drinking or for washing, and so on. The other problem that we're worried about is how this extra heat and damages to the environment will change infectious disease spread. We know that the mosquitoes are multiplying faster. This is the Aedes mosquito, our friend, if you live in the tropics. I call it our friend because we give it a place to live, and we feed it, and we give it a place to multiply. But I was in Long Island last year in the garden of my daughter, and I was being bitten by mosquitoes. And to my surprise, it was Aedes aegypti and Aedes albopictus that was biting me. And I thought, these are tropical mosquitoes. What are they doing here? I went to the Long Island website, the health department, Nassau County, and sure enough, they have been documenting this bug. As temperatures get warmer, it can live further and further north. And here is the tick that transmits Lyme disease, which is also going further and further north in the US and elsewhere. Another worry is as the ice in different parts of the world is being melted and thawed, there's a risk that some microbes, some organisms that have been frozen for a long time will re-emerge. Sea level rise. This chart we made in the Bahamas about 18 months ago, 15 months ago, and I asked people, are you planning to take a mortgage? And a lot of hands in the room went up. And I said, where are you going to take your mortgage? Where are you going to build this house? Let's look at what will happen with sea level rise in your country by 2050, around the time the mortgage will come to an end. And you see the red areas in New Providence which is where Nassau is, in Grand Bahama and Abaco, the red areas are the areas that are at risk of regularly flooding by 2050. The room was very silent. But this is not only the Bahamas, parts of Trinidad and Tobago, parts of Florida, parts of Jamaica, Guyana, Belize, Suriname, we all face this threat of sea level rise and damaging to the water supply, threatening houses. Really a lot of cause for worry. This is Guyana, the major floods of 2005, where we had a low-lying capital and seawalls collapsing, a big outbreak of leptospirosis as a result of this outbreak. Sorry, as a result of this flood. And the flood is compounded sometimes by human actions, where you had a lot of blocked drains and you had poorly maintained pumps. So that the inundation of rain, coupled with high sea levels, coupled with the poor maintenance and blocked drains, led to this situation for 6 weeks of a flood. These kinds of extreme events are leading to more migration and population displacement, and UNICEF here documents an increase by 6 times of children displaced by storms. I mentioned earlier we have a presentation later in this course on the impact of people in Barbuda who had to migrate from their homes. I encourage you to come to that one. Venezuela, often in the news because of the crisis of mass migration, and about which there's not much published, that climate change has contributed to this. Less rain, loss of the Andean glaciers means there is a water shortage, and the country has a high dependence on hydroelectricity, which then led to a number of other problems in water and food shortages, contributing to the mass migration. The economic impact of this is tremendous, especially on the smaller islands' economies, and of the top 10 countries by economic losses. I was surprised to see this globally. Of the top 10 countries by loss as a percentage of GDP, 9 were island nations in the Caribbean. Climate change and non-communicable diseases are both typified by an overconsumption of food and fossil fuel, driven by some commercial determinants. One of the things we see is a high number of deaths among people with NCDs in the months after extreme weather events, such as was documented in Puerto Rico after Hurricane Maria, given the disruption to services and medicine supplies. So people with diabetes, heart disease, kidney problems were more vulnerable in that situation. So the need to include such people in disaster planning and pre-identification of people with NCDs before an extreme event is important. Coming to the last bit now, to draw our attention to a sobering fact that the healthcare system is responsible globally for 4 to 5% of global emissions of greenhouse gases. And if the healthcare sector were a country, it would have a larger output than Japan or Brazil. So we are supposed to first do no harm in the health sector. And this means that one piece of action that is needed is for the health sector to become greener. Health professionals have an extremely important role in all of this, for public and patient education, to identify the adverse effects on vulnerable groups, research and surveillance data collection. I'll say a bit more about that. Improving resilience and greening of health facilities. If you work in a health facility, you actually have an obligation to talk to the hospital administrator, talk to the chief nursing officer, the chief medical officer. What are we doing about this? And advocacy as trusted professionals in society. It's interesting, this survey from the United States shows that of the professions in the world, that nurses, doctors, pharmacists, teachers are the people who are trusted the most in talking to the public. As you might expect, telemarketers, and sad to say, politicians and car salespeople are not trusted so much. But it's very interesting. We in the health community have more influence than we might believe to change public opinion. However, we also need to become more educated and equipped. And so I'm so glad to see so many people attending this course. We've been involved in 3 knowledge attitude practice studies in the Caribbean in the last couple of years that cover Guyana, Trinidad and Tobago, Barbados, Jamaica, the Bahamas. And this is a sort of a synthesis that everybody has heard of climate change, but less understanding of the main causes, less understanding of the impacts on health and healthcare, knowledge of what to do is lower, less than half. And many people perceive barriers. They don't have the tools, they don't have the knowledge, they perceive that they don't have the time, which is understandable, or that their superiors will not be supportive. And less than 10% in these surveys report any green action in the workplace, such as renewable energy, such as composting. About a half of these folks reported, I don't show it here, but having the disaster plan and the occupational safety and health plan. They knew where it was, they knew what it was. This is just a picture of the WHO Director General receiving a letter from non-governmental organizations in climate and health. So we have an important role in advocacy. I want to one word on research and data. We have been working on a research for action agenda for climate change and health in the Caribbean. You see the links to the publications here. And these aim to reduce climate change associated ill health and the factors that lead to that, and increase the capacity to prevent and protect vulnerable populations and to have safer, greener, more resilient health systems. There are 18 priority areas in that agenda. You can have, I encourage you to download it and have a look at it if you're a student or a lecturer. This is an extremely valuable document. This chart shows a synthesis of the PAHO Smart Healthcare Facility, combining resilience and green for sustainability. And this is a picture of the Chateau Bel Air Health Center in St. Vincent and the Grenadines, showing the renewable energy panels, the rainwater storage. It's been made safer, so it's stronger against the hurricanes. And it's also greener, so it's less dependent on the electricity supply. This is I like this picture of nurses in Sangre Grande Hospital in Trinidad, planting up trees in their hospital compound. And this has actually led to quite a lot of other actions in this regard and greater environmental awareness. I conclude with just a couple of slides. This for EarthMedic and EarthNurse is our pledge. You can go to our website and take the pledge. It takes about 15 seconds to join. And to recap, climate change is a real problem. It's a real phenomenon. It's, if you've thought maybe it's not real, it is. And it's scary, it's alarming. It's human induced, mainly through the burning of fossil fuels, and it's very bad for people's health, especially for more vulnerable groups. It worsens things that we already have that are bad. Experts all over the world agree on this. And the good news is that there's much that can be done to mitigate and to adapt to climate change. And health professionals have a really essential role to advocate for patient Earth. So I encourage you to attend the rest of this course, get better informed, get equipped, talk about this issue in your family, talk about it in your workplace, talk about it with your colleagues, and act, take action. Thank you very much. Muchas gracias. Merci beaucoup.
Thank you so much, Dr. Hospedales. Such an inspiring and informative talk that you just gave. We have many questions in the Q&A. And for those of you who have questions that are arising right now, please use the Q&A function at the bottom of your Zoom screen, and we'll get to as many questions as we can. We are going to have a 20-minute Q&A session and discussion right now, and then we'll be joined by Dr. Edward Maibach. So James, thank you so much. We do have some really interesting and really actually very important questions here from the crowd. So the first question, if you could clarify, does degradation of air quality have an impact on health outcomes other than cardiovascular and respiratory diseases?
Good question. The air we breathe goes into our lungs and then into our entire circulatory system. So this has implications for the unborn child. It has implications for your brain, for dementia. It has implications for cancer. So there are a lot of other health implications of poor air quality as a result of air pollution.
Yeah, absolutely. And, from what I've seen, it can range from preterm birth to stillbirths due to exposure from both, fossil fuel related air pollutions as well as particulate matter from wildfire smoke. We also see that air pollution is associated with Alzheimer's disease, dementia, depression, suicidality, so many different areas. And like, as you said, it's because these particles cross over from our lungs into our circulation and go to every organ in our body. So, there's so much that can be gained, I think, from focusing on reducing fossil fuels and the particulate matter, both in the short term for health outcomes, but then in the long term to ameliorate the impacts from climate change. So such an important question. The next one, James, that we should talk about, the question is, given the potential increase in heat stress related illnesses and injuries among outdoor workers due to rising temperatures, what strategies can be implemented to mitigate heat related risks and protect worker health and productivity?
And that is a very important question for all outdoor workers, for sports people, for the security forces. What strategies can be adopted? Well, there are many. I wrote an article on heat and humidity, too much to bear. So as I learned myself a few months ago, you got to have rest breaks when you're in the extreme heat. Must stay hydrated. Must have access to shade. And employers and labor unions and others need to take this into consideration. There are practical tips as well. I see in Central America, they've changed the hours of work for people in the sugarcane industry. They start work at 3 o'clock in the morning. Yes, 3 o'clock in the morning. But by 9 or 10 o'clock, they're finished to avoid the killing heat of the day, which is causing perhaps a major contributor to kidney disease. If you live in an area where the heat is extreme, especially a concrete jungle where you have the urban heat effect, there are other measures you can take. Paint your roof white to beat the heat. Trinidad and Tobago, I've just seen one of our major paint manufacturers is bringing in heat reflective paint. So putting heat reflective paint on the roof, on the walls of primary schools, of homes for the elderly, this can help to protect some of the vulnerable groups. Your question was focused on outdoor workers, and I hope I give a bit of an answer there that's useful.
Yeah, absolutely. And I think all of us as health related professionals, even educating our families, our coworkers, our patients, our communities about what the signs and symptoms are of heat related illnesses, so we can recognize in ourselves, we can recognize in each other, and be able to know when we need to stop working, take shade, take rest, and drink water is so important to recognize those early signs and symptoms. And I think that's something that we can amplify as health professionals as well. So more great questions coming, James, from Paula, Teresa. There is climate awareness within the medical community, but how do we engage the healthcare sector to take a more active role?
Good question. Well, wherever the health sector is a big beast. You usually have a policy making level with your Minister of Health and your senior advisors or your vice-ministro. So take the argument to that level. They're elected officials. They need to put climate more centrally into the planning. Encourage others to get educated and come to this course and the rest of our courses. You got to look at the health facilities that we're working in and how to make them safer and greener. And the PAHO Smart Hospital program is a very good example of how to do that, especially if you're living in the islands and exposed to all these storms. Other measures would include the pharmaceutical supply and how you procure and what you buy and where you're buying it from. So there are many different areas that can be addressed to make us safer and make us greener and more resilient. And that's going to be important as well for the staff. For those of us who work in a healthcare facility, having a safer, greener environment is better for your mental health. And of course, it's better for your physical health.
Thank you so much. Maybe a little bit of a follow-up to that from Johannes. Johannes, he says, it was interesting to see that the smart hospital withstood the hurricane. Has there already been any formal evaluations of this approach, or is this anecdotal for now?
Very good question. We're part of a small grant from the NIH to evaluate the effectiveness of climate smart hospitals. Let me tell you, I used to be on the Caribbean disaster response team for 8 years in the late 80s and the 90s, and I saw what hurricanes can do to a hospital that is not smart, that is not strong and not resilient. We've seen how health facilities can be without power for weeks or sometimes even months after an extreme event. This happened in Dominica, it's happening in Puerto Rico. So I would say that we have practice-based evidence that health facilities that are made climate smart do better. But we're working to strengthen that evidence base so that more governments will adopt this as policy. That's a really important question you've asked.
Thank you so much. And maybe this is a question sort of towards the Caribbean research agenda, which I know was recently launched, and it's just an incredible reference for any scientists or even people involved with policy and medicine. The question here is, how can we set up surveillance systems to detect climate change-induced health problems in the Caribbean?
That's another good question. The climate change data about precipitation, temperature, dust, storms, wind speed tend to be the purview of the meteorological services and groups like the Caribbean Institute of Meteorology and Hydrology. And we need to strengthen the linkages between those silos, between those who have the met data and the climate data with those of us who are involved in seeing the health outcomes, whether it's in the emergency room, the pharmacy, the general practitioner's clinic. So that's an important ongoing piece of work to join those up and have more climate smart surveillance, climate smart public health.
Yeah, absolutely. And, from where I sit as an emergency doctor, I feel like emergency departments are these surveillance systems that we have set up, right? Because every time it's hot outside, we see more patients come in. And specifically, we see the vulnerable patients come in. The same thing is true when there's flooding or when there's any climate-related issue. So even just as a starting point, looking at trends in hospital usage data or clinic usage data, which many of us in the health professions can get access to through our institutions, and then working with a meteorologist or a climatologist in that community to be able to look for trends is kind of, I think, the low-hanging fruit that we have in this situation. And by virtue of our profession, we can start looking at this data and trying to understand the linkages, and that can really help to improve, I think, health system resilience in the long term. James, this is again kind of a really great research question, which is around how do you specifically link the country's or a country's routine surveillance data of infectious diseases to climate change?
Gosh, we're gonna have to run a seminar just on that.
Uh,
That's a really good one. And most of our countries have systems whereby they have weekly or monthly reports, surveillance reports. You can correlate that with what's happening with rainfall, with what's happening with temperature, and what's happening with disease. Take something like dengue or take gastroenteritis. There is good data now that rainfall and temperature, including nighttime temperature, from good data from the CIMH, that this can help to predict better the outbreaks of dengue that we're seeing. You can link the availability of water with gastroenteritis and so on. So I think that's another very important question. We need a deeper dive into how to link routine surveillance data, or maybe adjust it a little bit so that it better connects to the climate change, the changes we're seeing in climate and heat. And not all, sometimes we may need to look at our sentinel surveillance sites, which are collecting syndromic data on fever, on diarrhea, on cough, fever and rash, and see how those can be linked to changes in climate and weather conditions.
Yeah, absolutely. We have a lot of researchers in the audience, so that's incredible. And I think there's
Yes,
a lot of opportunity here to increase the amount of research that there is in the Caribbean in this space, because I think there's not enough and there's so many great questions, and we really need to start tackling them. James, a lot of interesting questions here about smart hospitals. And there's one question here is, how widespread is the greening of hospitals in the Caribbean currently?
Oh, I think, so that's a good question. I think we've had a history, and PAHO has been working on it for like 20 years, of safe hospitals to make them stronger and more resistant to the hurricanes and the floods. The greening side is newer. That is to say, renewable energy, rainwater harvesting, composting, looking at the medicines and diagnostics that we're using and how to make those greener, looking at asthma inhalers and how to switch those from, very greenhouse intensive ones to greener ones. So that's a newer field. The PAHO Climate Smart Hospital program has reached about 54 hospitals and retrofitted them. But just in the English-speaking Caribbean, we have about 600 hospitals. So we've just begun. This is anybody has $1 billion for legacy purposes, we could really use that to go from 50 to 500 by 2030. That's my dream. I see Ed's joined. Welcome, Ed.
Yeah, hi Ed. Good to see you. We'll do one more question. There's so many great questions in the chat. I'm just going to do one more, and then Ed will turn it over to you. James, last question. What can we do as health professionals to take action in our workplaces? And this might be a good segue.
That's going to be a good segue, Ed. But in the workplace, open your eyes and see what's going on around you. Do you have inverter ACs or old-fashioned ACs? Is the roof painted white? Go talk to the hospital administrator. Go talk to the chief of procurement. Say, where are we with getting a smart hospital? Go and find out if the hospital has ever done a hospital HSI, a hospital safety index inventory, which you can do. You can download it and walk around the hospital and start looking at what's do a green checklist and go around the hospital and calculate your green score. We aim to be A for safety and at least 70% on green. That's the gold standard for a smart hospital. So those are practical things that people can do. Talk to your colleagues about it. Find out if there's anybody else interested in it. There's almost always a disaster committee and an occupational safety and health committee. Go talk to those folks. Find out what's the disaster plan for this hospital. Does it include a consideration of climate change? What's the disaster plan for your country? Does it include consideration of people who have chronic health conditions and disabilities? Is there pre-identification of those folks so that come disaster time, they can be medevaced, or who needs insulin, or who needs extra? So those are some of the measures we can take to prepare in a health facility, whether you're in primary care or whether you're in the hospital.
Thanks so much, Dr. Hospedales. Well, we'll get you out of the hot seat for now. We have so many great questions, and I think we're going to be able to answer all of these questions in the upcoming sessions of this course. So stay tuned. And now next, I'm so delighted to welcome Dr. Ed Maibach to our session today. Dr. Maibach is a distinguished university professor and the director of the Center for Climate Change Communication at George Mason University. His research illuminates public understanding of climate change strategies and how we can enhance them. Dr. Maibach is a fellow of the American Academy for the Advancement of Science, a member of the National Academy of Medicine, and he serves on the board of directors of the Global Climate and Health Alliance, as well as many other incredible things. So thank you so much for being with us here today, Dr. Maibach, and I'll let you take it away.
Hey, Cece, thank you for the invitation. Thank you for allowing me to join your incredible group. I see that there are 500 people with us tonight. That is absolutely spectacular. And James, I'm so sorry that I missed 95% of your comments, because you are one of my spirit guides. You have taught me so much about how to think about these challenges, how to think about these opportunities, and what is most important for us to get done. I want to build on what I did just hear Dr. Hospedales saying, which is like acknowledging the obvious. Our climate is changing. It's having profound impacts on the health of people in our communities. As health professionals, we have obligations as a result. And the most proximal of those obligations is to respond to the situation on the ground in our communities, the ways in which our people are being harmed, and finding ways in which we can prevent as much of that harm as possible. But there is another way that I'd like all of us to think, and that is about our opportunity together. The opportunity that we have to work across borders, to essentially use what I consider to be our superpower. And our superpower is the fact that we are trusted. We health professionals, in surveys conducted around the world, always show the same finding, which is that health professionals, doctors, nurses, pharmacists, and other health professionals, we are the most trusted groups of professionals of any institution in countries around the world. And that trust is our superpower. It gives us an extraordinary opportunity to make a difference in influencing the way people think, influencing the way people act, and most importantly, influencing the way policymakers think and act. If we're constantly working at the retail level, trying to protect the people in our jurisdiction, whether that's our clinic or our county or our nation, we're always going to be behind the 8 ball. What we have to do is we have to work, although we are all obligated to do exactly that. But what we have an opportunity to do together is to work together across borders to try to convince the real decision makers, the leaders of the nations of the world, who ultimately are going to have to decide, are we going to be serious about limiting the warming of our climate to less than 2 degrees, ideally closer to 1.5 degrees, or are we going to essentially dismiss our real obligations and just kick the can down the road and let the warming come as it will, because it's more expedient, it's easier to continue with the fossil fuel economy. Not today, but not tomorrow, but the day after tomorrow, I have a commentary being published in the journal, The Frontiers of Science. And I was invited to write this commentary in response to an article that they'll be publishing day after tomorrow that is doing a review of the literature on the human immunology implications of climate change. I'm not an immunologist. I know very little about immunology. I'm not really qualified to write a commentary on a lit review about the immunologic implications of climate change. But the editor-in-chief of this journal allowed me latitude to write whatever I wanted to write. And what I chose to write is this article. I don't know if you obviously can't see it, but I'll read you the title, because the title is what I really want to convey in my next few minutes with you. The title of my commentary is Accelerating the End of the Fossil Fuel Era, a Human and Planetary Health Imperative and Opportunity. And I'm choosing that concept of accelerating the end of the fossil fuel industry. I chose those words because at the end of COP28, Cece and I were together in Dubai for COP28, and many of you may have been with us as well. But at the end of COP28, the world's leaders committed to triple renewable energy production by 2030. That's a very short number of years from now. And, quote, transition away from fossil fuels. Well, the transition away from fossil fuels has to happen really darn fast if we're going to limit the warming to less than 2 degrees, again, ideally to 1.5 degrees C. I would imagine that in James's talk, that he talked about the fact that every 1/10 of 1 degree of warming above and beyond 1.5 degrees will carry with it grave public health consequences. Every 1/10 of 1 degree of warming matters. It matters in terms of the human health and well-being, and essentially it matters in terms of the conditions we are leaving for our children, for our grandchildren, and for their grandchildren. So from the perspective, as I see it, from my public health perspective, our most important goal has got to be to shave as many 1/10 of 1 degree of warming off that warming curve as humanly possible. because every 1/10 of 1 degree of warming that we prevent is a profound benefit to the health and well-being of the human civilization that will come after us. And if you really look at what it's going to take to shave those as many 1/10 of a degree of warming off as possible, it's incredibly simple and clear. It really clarifies exactly what we, as the community of health professionals in the Americas, in the Caribbean, and around the world, exactly what we need to do. And that is, we need to use our trusted voices to accelerate the end of the fossil fuel era, to accelerate it to the fullest extent possible. That is our task. And I think we're up to that task. That's the bad news is we've got a lot of heavy lifting to do. The good news is we are up to it. In my career as a public health professional, which has been more than 40 years in duration now, I have largely thought about tobacco as being public health enemy number one. Tobacco as being the leading cause of preventable early death, mortality, and the leading cause of preventable morbidity worldwide. And I don't mean to diminish the threat that tobacco use poses to human health and well-being. It is still one of the leading causes of premature avoidable morbidity and mortality. But when you tally up the consequences of air pollution alone, air pollution driven by the combustion of fossil fuels to run our communities, it is very clear from the tallies that have already been published that fossil fuel air pollution is already a more potent killer, a more potent cause of avoidable morbidity and mortality than tobacco use. And that is only one of 8 different pathways by which climate change is harming human health. So if we are serious about sort of fulfilling our obligations as health professionals, we ought to be tackling the number one cause of avoidable morbidity and mortality worldwide. And that is very clearly the fossil fuel economy. 20 years ago, it would have been impossible for us to tackle that because 20 years ago, we didn't have the technologies, the clean energy technologies that we have today. But today, the economics alone of clean energy are so compelling that if it weren't for government support, government policies that continue to perpetuate the supremacy, the hegemony of the fossil fuel industry, we would essentially, without those government policies privileging the fossil fuel industry, that industry would collapse very rapidly because the clean energy industry would take over because it has a better product and it can produce and deliver that product at a lower cost. So most of our policymakers don't understand that yet. Most of our populations, the people in the communities where we live, they don't understand that yet. We, my friends, we have the opportunity to use our trusted voices to help them understand that we have better options. The fossil fuel era served us well, served humanity well, but the time for that era, the fossil fuel era to come to a close is now. The time for the clean energy era to take over is also now. And why is that the case? Well, if the economics weren't good enough, certainly the health argument is good enough. The research that my team and I do has focused, as Cece indicated, I'm a professor. I run the Center for Climate Change Communication at George Mason University. A lot of our research over the past 5 or so years has focused on answering the question, if we use our trusted voices as health professionals to explain the impacts of climate change on human health and well-being, and to explain the profound human health benefits of transitioning to clean energy and taking other actions to protect human health from our changing climate, will it make a difference? Will it create public will and political will for the very solutions that will address the root cause of the problem, the burning of fossil fuels and the warming of the planet that it's causing? And the answer from our research emphatically is that it will. Of all of the narratives, of all of the ways we've ever tested to explain climate change and the impacts of climate change, the harms that it is causing, and what we can do about it, the most powerful of all of those narratives that we've tested is the health narrative. And in part, it's because as I said before, we have a superpower. We are uniquely trusted, and the ways that the narrative that we can bring to bear, the information that we can introduce into the public dialogue about the human health harms of climate change and the human health benefits of climate solution, particularly ending fossil fuel use and transitioning to clean energy use, is a very powerful narrative. And our research has shown that it's powerful in part because it works uniquely well with conservative voices. A big part of the opposition to the clean energy revolution is coming from our conservative brothers and sisters and the influence they have in terms of conservative policymakers. Well, the good news from my perspective is that when we use our trusted voices, we can have a profound impact across people, among people across the political continuum, but we are perhaps uniquely qualified to make a compelling argument to our conservative brothers and sisters. In fact, in our research here in the US, when we ask people how much you trust different sources of information about global warming, the most conservative Americans and the Americans who are least likely to be concerned about climate change say that the person that they trust the most with information about global warming is their primary care doctor, which is a really remarkable research finding. In part, it's because their primary care doctor is somebody that they know, somebody that they value, somebody that they trust, and the fact that they are so open to learning from their primary care doctor and other health professionals about climate change creates this really unique opportunity for us. So we've got a lot of heavy lifting to do. I want us to do that heavy lifting together, because we aren't going to end the fossil fuel era one country at a time. We have to end the fossil fuel era one planet at a time. The more that we work together, linking arms as health professionals across national boundaries and leaning in to the policymakers, the relatively small number of people worldwide who really are going to make a difference about continuing to privilege the fossil fuel industry or doing everything possible to bring it to a close, an orderly close that protects human health and well-being, we have a special opportunity. So I want to end my comments by actually reading the last paragraph of my commentary to you. I encourage you to all read it. I sent it a author's proof to Cece. She can deliver it to you, but I just want to read you the closing paragraph of the commentary. Can such education and advocacy by the health community make a difference? The following case study suggests that it can. In 1980, 7 US and Soviet physicians established an NGO called the International Physicians for the Prevention of Nuclear War. Their message to the world, especially to Ronald Reagan and Mikhail Gorbachev and the other leaders of the United States and the USSR, was simple. Their message was a nuclear war would destroy civilization and might extinguish human life. In 1985, 5 short years after their organization was founded, they were awarded the Nobel Peace Prize for their central role. This is a quote from the Nobel Peace Prize committee. They won it for their central role in helping to open arms control discussions between the US and the USSR. 2 years later, Mikhail Gorbachev published his autobiography. It was called Perestroika. And in his autobiography, he said these words: their work, their health professionals' work, commands great respect, for what they say and what they do is prompted by accurate knowledge and a passionate desire to warn humanity about the dangers looming over it. In light of their arguments and the strictly scientific data they possess, there seems to be no room left for politicking, and no serious politician has the right to disregard their conclusions. A few years later, Gorbachev actually sent a thank you note to the executive director and the board of IPPNW. And in his thank you note, he said, "I want to thank you for your great contribution to preventing nuclear war. Without it and other effective anti-nuclear activities, this anti-nuclear treaty would probably have been impossible. The trusted voices of health professionals made the impossible possible. And that, my friends, is exactly the opportunity that I feel we have in front of us. We can link arms, we can use our trusted voices to try to convince the leaders of the world that what might look impossible to them is an absolute mandate. It's an imperative. And we can use our trusted voices to make the impossible possible. So with that, I'm going to stop, turn it back over to you, Cece, and maybe love to hear your thoughts. James, I see you're still with us. Love to hear your thoughts as well.
Thank you so much, Ed. And I'm so inspired by the work that you're doing and the way you're really understanding this in a scientific way of how we can be most effective and most efficient as health professionals in getting these messages across and changing the way we're running our societies, honestly. We have some really great questions and comments in the chat, and I wonder if we could entertain a couple of them in our final minutes here. So there's a question here that says, health professionals are trusted voices. I think you convinced everybody. We would then have the responsibility to convince policymakers to make the right move for our safety. What is the... I think you both might have something to say about this.
Yeah, you froze for a moment. We didn't hear the end of the question.
What's the most practical approach to convince policymakers?
Well, two practical approaches. One is go directly to the policymakers, right? They are the decision makers, and make the case to them. We have lots of evidence. In this course, you're going to be learning much of that evidence. We've got lots of evidence that climate change is harming human health and well-being already in a whole variety of different ways. So make that case simply, clearly, powerfully, and use the data from your own nation to make that case. Because, while we care about humanity, we of course care about the people we're entrusted, who we are responsible for the most. So use the local data to the extent that you have it. And it's three types of data that I want you to use. One is make the case that climate change is harming health. Two is make the case that climate solutions are an unbelievably powerful intervention that promotes health. Incredible, climate solutions are health solutions. We can make that case very simply, clearly, and powerfully, and make the case in your using data from your own nation to the extent that you can. And then thirdly, make the case that the public is already with us. Find survey data from your country showing how the proportion of members of your country who are concerned about climate change and who would like to see leaders implementing smart, effective climate policies. And in every country where I've ever looked at the data, the majority of the public is overwhelmingly in support of leaders taking action. So that's an easy case to make. Climate change is harming health. Climate solutions are health solutions, and the majority of people, the majority of voters are already with you. Take that argument directly to policymakers. They will listen. They might not all act on it, but they will listen because you are respected. And take that very same argument to the public. Take that argument to voters. Help voters understand an aspect of climate change that they heretofore had never been privy to. So you can indirectly build public will as a means of building political will, and you can directly build political will by briefing your policymakers.
Thanks. Awesome. One more question, and I think this will actually, if we talk about this a little bit, we'll answer several questions in the chat. I'm wondering if you can share a little bit about the idea of a just transition. Several of our audience members have brought up, that many people in developing countries are burning fossil fuels for their basic needs, and also bringing up the point that, the clean alternatives like lithium-based EVs also cause harm with mining. And so how do we sort of move away from fossil fuels in a way that's fair, that's just, and that's also looking out for, new externalities that could arise?
Yeah, and obviously I can't answer that question in a minute because it's a really important question, and
Yeah.
it's a complicated question. And I know for a fact that it's on your curriculum, right, for the rest of this course, is you're really going to go into that at some level. But the point that you're making, and the point that sort of is consistent with the point I'm trying to make, is yes, we don't want to do this in ways that have perpetuated prior harm. In my 4 decades in public health, 4 decades ago when I was trained, we were talking about the behavioral determinants of health. And that really was kind of revolutionary. We were moving away from thinking about healthcare as the fundamental determinant of health, and we were moving towards the behavioral determinants of health. And that was better than thinking about healthcare as the health as a product of healthcare. But in the interim, we actually got better. We got smarter. We got wiser, more mature in our understanding of what the drivers of health are. And so for the past 20 or more years, we have all talked about and worked on addressing the social determinants of health, because we know the social determinants of health are even more fundamental than the behavioral determinants of health. Because if you don't get the social determinants of health right, it's not fair to expect people to be able to embrace healthy behavior. But now we know we're even wiser. Time is you can live and learn if you're willing to learn. And we've now learned that the ecological determinants of health are even more fundamental. So as we move to address the ecological determinants of health, which are undermining the social determinants of health, we need to do that in ways that are just and equitable. We can't let the mistakes of the past continue to we can't make the mistakes of the past in the important actions that we need to take going forward. And that's, I think, where the rubber meets the road in terms of, yes, this is the transition we must make. We must bring the era of the fossil fuels to a close and scale up the era of clean renewable energy and other climate solutions. And we must do it in just and equitable ways.
Thank you so much, Dr. Maibach. I feel like we could talk for hours. There's so many great questions. And I think that just, speaks to the point that we are going to be together for the next 5 weeks, every Tuesday and Thursday, digging deep on all these really important and complex questions related to climate change and human health. And we're really just getting started today. So a huge thanks to you, Dr. Maibach, Dr. Hospedales, for sharing your knowledge, your wisdom with us today. And I want to share a little bit of information about what you're going to expect next from this course. So on Thursday, that's April 4th, same time, same place, we are going to have a deep dive on extreme weather hazards, specifically looking at hurricanes. We're going to hear from Professor Stevenson as well as Dr. Latoya Storr, both who are incredible experts in this space. And the session is going to be moderated by Dr. David Farrell, who is the principal of the Caribbean Institute for Meteorology and Hydrology. So don't miss this session. It's really going to be an important one. It's going to build on today and really kind of put down some fundamental knowledge and answer some really important questions about human health in the Caribbean. And super important, we want your survey feedback. We want to know how this session was. Did we answer your questions? What else do you want to know? So please, there's a QR code here. There's also a link in the chat where you can answer the post-session survey. There's also a link where you can go to collect your CME. We're starting a new, piloting, I would say, a new idea during this course. We are opening a WhatsApp group where you can receive updates about the course, really interesting news articles related to climate change and health in the Caribbean, and other updates that you would find relevant to this course. So you're welcome to join the WhatsApp link. You will only receive messages from the course organizers. That's just to minimize, a lot of the back and forth. But for the duration of the course, this will be a channel for us to send you really interesting and relevant articles, course updates, and etc. Dr. Hospedales, did I miss anything?
I think you've done a good job there. I wish we could keep going. Please attend the rest of our courses. Ed, thank you very much. I do believe the 40 or so million doctors and nurses of this world, when history is written, would be the ones who really help to move the curve. Because right now, governments and big business are failing us, to be honest. We need to take that health argument to the elected officials. Later in the fall, we'll be running a how-to course on how to engage elected officials will be part of what we'll be focusing on.
Awesome. Well, the foundation of all our advocacy and all of our work is education. And, we're here to get wise on this information so that we can make the provocative arguments to policymakers, to our communities, to our institutions, and really advocate for the evidence-based changes that are going to move the needle on this. So we are so much looking forward to seeing you on Thursday. And please feel free to reach out to us if you have any questions. And until then, take care and have a great rest of your day or evening.